Hello and welcome. One of the most common things I hear is I've tried every diet. Nothing works for me. And honestly, they're right because for most programs, they treat everyone the same. But you are not the same as anyone else. Your metabolism, your hormones, your blood sugar, your blood pressure, your inflammation levels, they're all unique to you. That's why metabolic balance is so different. It starts with your blood work, real data about your body, and from those lab values, a completely individualized meal plan is created. Not a template, not a guess, a precise blueprint designed for your metabolism. Hi, I'm Dr. Eriidina Ojiiwawh, also known as Dr. E, and I am a certified metabolic balance coach. For the 25 years I have been in practice, I've studied how each system in the body influences the next. And when we match nutrition to your exact lab results, the body responds. Blood sugar stabilizes, belly fat starts melting away, blood pressure improves, energy comes back, and for the first time, you actually feel like a plan was made for you because it was. If nothing has worked for you before, it's because nothing was personalized enough. Your body has the answers. We just have to look at your labs to find them. I have been fortunate enough to be a part of so many life changing transformations, and I really look forward to the opportunity to be a part of yours. Thank you so much for taking the time to tune in and to hear what metabolic balance is all about. So, what is metabolic balance? Metabolic balance is an innovative, all natural nutrition program that brings balance to your hormones, optimizes your health, and leads to a new, invigorating lifestyle resulting in successful long term weight management. Metabolic balance was developed over 25 years ago by Dr. Wolf Funfack in Germany. The program was originally designed to heal inflammation and help reverse metabolic syndrome in his patients, which also resulted in achieving optimal body weight. This program was designed by studying the chemistry of one's individual lab values and the chemistry of food, and then using food as a prescription. To date, the program is managed by dedicated physicians and nutritional scientists. So, metabolic balance. The foundation of the program is metabolic balance's unique capability to develop a truly personalized nutrition plan based on an in depth analysis of your unique blood values, medical history, and personal likes and dislikes. Your personalized nutrition plan acts as your roadmap, indicating exactly what natural foods you should eat in order to orchestrate the biochemical changes needed for reaching your desirable weight and health goals. Metabolic balance is 100% natural. There are no prescriptions, injections, pills, shakes, or proprietary foods, nor, as some diets, are you required to keep points or count calories. Your local grocery store and farmers market can easily provide all the wholesome, nutrient rich foods listed on your personalized nutrition plan. So, what should you expect from metabolic balance? Weight loss and improved energy, better sleep, improved moods, less bowel and stomach problems, potential reduction or elimination of the need for high blood pressure, cholesterol, and diabetic medication, hormonal balance, improved immune function, reduced allergies and intolerances, improved joint inflammation and pain, save money on your weekly grocery bills without having to eat out constantly. You'll have your food ready and prepared, and you'll expect to see the highest success rate for life-term health benefits and weight. A potential benefit for sufferers from polycystic ovarian syndrome, type 2 diabetes, and metabolic program. So, how does metabolic balance work? So, the most important piece is that you get your blood work done. So, we can create a nutrition plan and use custom foods as a prescription. Past that, what you really will be following during the program are these 8 daily rules. So, let's get into them. Rule number one, you are to eat exactly 3 well balanced meals a day. No snacking. The number one hormone that we're working on balancing is insulin. So, exactly 3 well balanced meals per day will keep those insulin levels down. I assure you, you will be comfortable. The meals are designed to keep you full in between, so there's no need for snacking, just lots of water in between your meals. Rule number two: ensure there is at least a 5 hour break between meals. This is to give your insulin and your digestive system a break between your meals. Rule number three: make sure each meal lasts no longer than 60 minutes. Now, this is for you grazers out there. So, if you're working at your desk, you take a bite of your food, you work some more, take another bite, your meal can last for a long time. But because, again, we're trying to give your insulin levels and your digestive system a break, meals should last no longer than 60 minutes. Rule number four: begin every meal with 1 or 2 bites of the protein portion of your meal. So when you start your meal with protein, the amino acids will hit your system first, and they will trigger a release of a hormone called glucagon. Glucagon will slow down insulin, but it also signals your leptin response, indicating you are full. So again, it is all about that hormonal balance. Rule number five: be sure to have only one kind of protein per meal and have 3 different proteins per day. Again, this is for the maximum absorption of amino acids. Rule number six: if possible, do not eat after 9 p.m. So if you do shift work or if that isn't possible, of course, we can accommodate that. So rule number seven: drink the quantity of water calculated for you divided through the day. So you can drink more water that's prescribed, but you cannot drink less. Water plays such a vital role in so many functions in the body, and it's also your body's ability to excrete. 85% of weight loss will happen through urine. So you have to give your body the tools that it needs to do that. So your water prescription will be very important. And last but not least, rule number eight: eat an apple a day with one of your meals. An apple is a power packed multivitamin. It works to lower your uric acid and it helps to draw toxins to the colon for elimination. Okay, so let's talk about insulin. So, insulin is the major hormone we're going to be working with on metabolic balance to support you and your health and your hormonal balance. So, what happens when insulin levels are elevated? Your body's cholesterol will increase. Your triglycerides, the fat concentration in the blood, will increase. Your stress hormones, adrenaline and cortisol, will also increase. And when insulin is elevated, your melatonin, which is your body's sleeping hormone, will decrease. So you'll have some issues with sleeping. Also, what will decrease is DHEA, which helps your body build other proteins, and your human growth hormone will decrease. That also helps with weight loss. And then your body's ability to break down fat. So, this is why we want to keep insulin as low as possible throughout the day. So, now we're going to talk about how the program is broken up. It's broken up into 4 phases. So let's go through these phases. Phase number one is going to be your 2 day cleanse. It's a very gentle, light 2 day cleanse. It's very manageable, and I will coach you through this 2 day cleanse. Next, we move into phase two, which is called the strict conversion phase. So this will last for a minimum of 14 days. This is where for 14 days you really follow your plan as it's laid out for you, using the foods that are specifically designed for you. Again, you will be comfortable. In total, this is your 16-day metabolic reset. So phase one and phase two together is your body's 16-day metabolic reset. The only part of the plan that is a little bit more restrictive. So from there, we move you into phase three. Phase three is a much more relaxed version of phase two. This is where we bring in weekly treat meals and way more food choices, cooking oils, and condiments. It really does become a more relaxed phase because it needs to be more realistic. This is where you stay long term. You will stay in phase three until you accomplish your desired goal. Now, keep in mind, your desired goal isn't necessarily a body composition goal, but an all encompass health goal. You want to have good energy, good sleep, mental clarity. I coach my patients on what I call the 4 pillars of health: nutrition, exercise, sleep, and stress management. So, phase three is more of a long term phase. And to make sure you can adequately sustain and implement the lifestyle changes that last long term. And then we'll move you to the maintenance phase, which is a really important phase. Again, there will still be regular accountability check ins, but we will monitor your progress to make sure you can comfortably sustain your new lifestyle. We will put parameters in place so you will know exactly what to do if you feel yourself slip up. So, this is a simple sample food list. So you can see that this individual's meal plan, we're going to start with the proteins, and you can see they have plenty of seafood options. There's some meat options, poultry, yogurt, cheese, legumes, and nuts and seeds. Usually, there will be a consumption of eggs in there. Again, every nutritional plan is going to be a little bit different. And again, it's based on your chemistry. So, you'll also have your vegetables. You have some vegetables, which are lettuces, they're all combined. Then you're going to have your bread, which is always a 100% crispy rye bread cracker or whole grain rye bread. And then you're going to also have your fruits. Now, you have to eat your daily apple. There will be an additional food choices as well. So, in addition to the daily apple, you have some people will have some other fruits on their plan. So, we will start with your specific meal plan, and then we will work together to expand and build on that plan from there. So, what does a metabolic balance meal plan look like? This is a simple sample meal plan. What a lot of my patients say is that they appreciate that these are completely flexible suggestions. This is not day one, day two, day three, repeat, is not color coded. It's simply nine completely interchangeable options. So every time you have a meal, you have nine meal boxes to choose from. It offers a lot of variety and flexibility. I'll further go through your specific individual meal plan with you and how to interchange these options with one another. So, this is an outline of how the consultations will flow with me. So, how your appointments work. Our very first appointment, we will complete your intake form, evaluate your health goals, what you're looking to accomplish, evaluate the four pillars of health, and I will send you a welcome package, including the requisition form for you to get your blood work. Once your blood work is completed, we will meet over Zoom. So once your blood work is complete, your labs come directly to me through my practitioner portal. I will take all the results from your labs and all the information from your medical assessment and intake form. I'll create a profile for you. I'll send it to the doctors who are in Germany, and they will send me the plan. So from there, we'll meet over Zoom again, and I will walk you through your plan, page by page, step by step, so that you fully understand. I want you to be very comfortable, really comfortable with and ask me any questions. You will be also instructed to fully read through your plan a couple of times so that to make sure you get a clear understanding and that you are ready to go. From there, we will select an official start date. Yay! And from the official start date, you and I will remain closely connected to monitor your progress, especially during those first 16 days. Past that, when you've been on the plan for the first 16 days, we'll meet over Zoom again and we will evaluate your results to date. And that's when we're going to discuss phase three and implement phase three when appropriate. Appointment number 4 is actually broken down into weekly accountability check ins. I hold my patients to weekly accountability check ins because I find that it is so important and detrimental for your success and for your progress. I do not work with patients on a short term basis. This is not a short term solution, this is not a temporary crutch. I really want to implement sustainable, lasting change. So the minimum I work with my patients is for 6 months. And in order to create sustainable change, we have to work through the obstacles that will come up within that 6 month period. And we will work through those together, which is why those weekly accountability check ins are so important. The fifth appointment is going to be the 3 month mark. We will meet again over Zoom, evaluate your total results. to date, and we will reevaluate the change that needs to occur in all four pillars. Again, nutrition, exercise, sleep, and stress management. In between visit 5 and 6, you will continue with your weekly accountability check ins. On visit 6, we will evaluate your results to date over Zoom. We will review phase 4 in detail and how to sustain and stay balanced for life. You will be given the full package outlining the changes in the maintenance phase. Review exactly what to do if you feel you're slipping. I will absolutely make sure you are set for life. I got you. So you will have all the tools you need, everything to reference and to continue on your health and wellness journey. So, what is metabolic balance's success rate? So, what classifies a successful weight loss plan? An individual reaches their goal weight and maintains it for 2 years. Metabolic balance has a 60 to 80% success rate. The metabolic balance program has a higher than 50% success rate in over 35 countries. That means that we are globally the highest successful weight loss program. So, what weight loss is expected? So, how much weight can I expect to lose? While everybody will respond differently, a realistic expectation is as follows: 5% of your total body weight during the 16-day reset period. So, it's realistic to lose 5 to 8% because during the reset period, that is when your body is reducing inflammation, stimulating enzymes, balancing hormones, flushing out toxins. Your body goes through a lot during that 16-day reset period. So, past that, 1 to 2% of your body weight per week will be lost. And so, that is a realistic expectation. So, the cost of the program. What is included? So you get your requisition for your blood work, complete custom nutrition plan from Metabolic Balance Doctors in Germany, bioelectrical impedance scale. I am less interested in your total body weight. I want you to have a better understanding of the composition. So your visceral fat, the fatty tissue around your organs, your muscle mass, your body fat percentage, your hydration, your body of water. This is what this scale is going to tell me, and this is what we will use for your weekly accountability check-ins. So 6 months of personalized coaching, a program that works without the yo-yo effect or the need to try something else, no additional cost ever. You will always have your plan to revert back to, and it includes everything. So all this for only $15.99. Now, because this is a 6 month program, if you break that up over the 6 months, that really equals to about $66 per week, which is probably more than you spend eating out weekly. And unfortunately, this is not covered by health insurance, but we have lots of options. We have aftercare. I am a care credit provider. You can use credit cards, anything that you're comfortable with. So the total cost of the program includes absolutely everything. You will be set. So I want to thank you so much for your attention and for taking the time to tune into this video. Again, I really look forward to the opportunity for us working together. I have, like I've said, seen amazing transformations with this program. It has been very life-changing for me, actually, just to see how amazing it is when you implement the right foods for your biochemistry and you fuel your body properly. The other thing that I will point out is that this program is so realistic. I work with so many variations of patients, but one thing they all have in common is that they are busy, very busy. So they need simplified nutrition plans that they can create and integrate into their daily life and works and makes sense for them. So again, I am so excited to work with you. Any other questions, please feel free to reach out, and I look forward to hearing from you. Thank you and take care.